So as far as DIO itself and the products that DIO provides, I've never seen a company put together such a complete package. When I'm prepared to do a really big surgery on a full arch case, whether it's 1 or 2 arches, I get one box that has everything in it. It's super organized. And for me, that's a big deal when I can lay it all out. My assistants can lay it all ahead of the surgery. I can walk in and know that every ingredient's there. There's nothing missing. It's all going to be there to put it together. I'm not going to have to run out of the room and go find things. Having provided world-class service with the finest technology available, with the best implant on the planet that integrates faster than anything else, I have restored some of these cases at 4 weeks, and they actually do integrate that quick. I'm still nervous because for so long we were taught that that can't happen really. Yeah, 4 weeks is when they're the loosest. I'm not seeing that. I'm still guarded, but so far so good. These implants really are amazing. The workflow has been a dream for me come true. The speed and the accuracy at which it happens, and then taking that final CBCT and looking at it, and the implants are exactly where you wanted them. The temporary fits perfectly, and the cylinders are right where you want them, and the patient walks out with those temporary teeth just how you imagined them, and they're happy with them. Having done many of these new full arch cases, I'm noticing 2 main things. First of all, the stress level in providing full mouth dentistry for these people, full mouth reconstructions using their DIO full arch workflow. The stress level for me is at an all-time low. Walking into an operatory with the sedated patients and having the confidence to go in and fully restore that arch and not be worried that all the things that could possibly go wrong, they're mostly under control now. There's been so much effort that has gone in to try to make this as predictable as possible for the benefit of our patients, and it is working for me. I am able to walk into a consultation and talk to a patient about what we can do and confidently tell them what the possibilities are and know that we can deliver it, and then to deliver it and have the patient be really happy with that. The second thing I want to mention about this, that what DIO has brought to the table with this full arch workflow, is the patient experience from their end. I have never had patients have so little pain, so little post-op pain. I am blown away still to this day that all of these cases have been in big surgeries. I mean, we're talking about full mouth extractions, extensive bone grafting, sinuses. We're talking about bone reduction guides and taking a large amount of bone off, a lot of tissue manipulation in the process of doing that. And yet, calling patients back a day or 2 later, and their pain levels are at a 3 or a 4, day 1 and 2, and at day 3 they're at a 0 or a 1, and a week out they're at a 0 and stay there. This is a new experience for me. Even having 1 implant can sometimes cause a week's worth of pain. But I have had so little pain with my patients, and that has been the biggest selling point that my patients are going to do for me by telling other people about that. So I can't recommend them highly enough. I don't think there's anything out there that's going to be comparable in terms of the value of what you're going to gain. Couldn't be happier with it. I'm excited to keep doing these cases, and I'm going to keep doing these cases. This is where I want to head, and if you were thinking about getting into full arch and you're looking for a workflow that is the best out there, DIO is it.